Hi, my name is Melissa Carr, and I work for Kentucky CancerLink, a nonprofit whose mission is to reduce barriers to screening, diagnosis, and treatment of cancer. I'm also a breast cancer survivor. In 2012, I found a lump in my breast through a self-breast exam, and I really feel strongly about how important this is and knowing the proper way to do it. I'd like to introduce someone who's going to provide us with that crucial information.
My name is Eleanor Broaddus. I'm a breast navigator. I'm certified in navigation for breast health, and I'm also certified in teaching breast self-examination, and that's what we're here today to talk about.
Thanks so much, Eleanor. I'll leave it to you.
Okay, so let's get started. Let's learn how to do it. There are two vital parts. We have to see, we have to feel. We definitely need to look at our breast. So we need a mirror. And we need to look at our bodies. We need to know our bodies. So when we look at our bodies, we're going to be looking at the front of our breast and each side, right and left. We're going to be looking with our arms down, front view, left and right in the mirror. Then we're going to be looking with our arms on our hips, and we're going to project our breast out, right and left. And then we're going to look with our arms all the way up because we need to see the underside of our breast. A lot of women have very pendulous breasts, and sometimes you may even need to lift them up, but we need to make sure that there's nothing going on the lower side. The last way we're going to look is we're going to actually bend over, and the way our breasts hang, that's important. We need to remember that our breasts are like our eyes. I have a picture of a set of eyes up here. Our breasts should be identical. If one breast is doing something, the other should be doing it also. So if you see one doing something different, hanging different, nipple pointing a different direction than the other breast, that's a red flag and you need to contact your physician. Something's not right. So we're looking for lumps, we're looking for dimpling, we're looking for changes in the skin, inverted nipples, scaly nipples, and spontaneous discharge. Lumps, bumps, anything that looks unusual, any change in a breast, you need to notify your physician. Dimpling, indentations, anything that is pulling inward, you need to let someone know about. Changes in the skin, that could be redness, even a stretching type of sensation that you might notice, a swelling, one breast is getting larger than the other. Change in texture, it feels like an orange peel. Sometimes that can be very unusual in the breast, but that is also a sign of a certain breast cancer. If you have one nipple that inverts and the other does not, some women have inverted nipples and that's their norm. So that's not something we're concerned with, but if you have one nipple that inverts all of a sudden, all on its own, and it's never done that before, that can be a concern. Scaly nipple, that may be something that is a dermatology type problem, but it could also be a certain type of breast cancer. So you need to follow up on that. Discharge is something that women get real concerned with, but we need to pay attention to that. Is it at a certain time? Is it a certain color? And how much of it? So it's spontaneous. It's not something that you force. It's something that you just find in your bra or on your night clothes, and you need to let your physician know about it. Pay attention to your body. Know your own body. Now, it's also important what you feel, so you need to use your hands. In looking at the feeling of your body, we need to know how to do this. So I've got a model here that I'm going to hold up so we can look at, but you need to know these 7 P's, the position that you need to lay in, because we used to always do self-breast exams in the shower, and we no longer do that. We haven't done that for several years. We need to know the parameter. We need to know the pattern in which to examine. The palpation. How do we palpate our breast? And how much pressure do we put on our breast? And how do we practice, and how fast do we go? So the position is lying down. We get into what we call a K-hand position with our arm above our head. We can lay it on our head, and then we're going to do an exam with the opposite hand. This hand is going to come over, and we're going to start up underneath our arm. Next, we're going to know our parameter. The parameter goes from the center of our chest all the way up underneath our arm to our collarbone, this clavicle up here, underneath our breast, which is called the bra line. So this is the complete area. In years past, we just went round and round on top of the breast tissue on that mound of tissue. But no longer. We need to check everywhere because we have lymph nodes and some breast tissue that surrounds the breast that we need to be checking. The pattern is no longer just one big circle. We're going to be doing circles, but we're going to be doing small circles, but we're going to be using mowing the lawn pattern up and down, back and forth. So we're going to be walking our fingers. We're doing these dime-sized circles. This is what is so different. We're using the pads of 3 fingers from the joint to the tip of your finger, and you're going to start up underneath your arm because you have lymph nodes there. So once you get your hand back over your head, go right up underneath your arm, and you're going to make, I'm going to show you how to do that. I'm going to show it where you can see it. You're going to take your 3 fingers and you're going to go white, dime-sized circle, then you're going to go deeper and then deeper. Then you're going to walk a finger and you'll slide the other 2 fingers to meet. Light, medium, deep. Walk your finger, slide the other 2, light, medium, deep. Walk, slide, light, medium, deep. Walk, slide, light, medium, deep. Walk, slide, light, medium, deep. When you get to the bra line, you're going to slide over a finger's breadth, light, medium, deep, and then you're going to walk your way back up, slide over, back down, back up, slide, back down, slide, back up. When you get to the nipple, then your arm can come down, and then you can finish the rest of your exam with this hand over to the center of your chest. Works very, very well, and you will have done a complete exam. Now, it takes a little bit longer than doing that shower exam, just going round and around, but you only do it once a month, and you are worth it. Practice makes perfect, so the more you do it, the better you're going to get, the faster you're going to get, and you're going to get to know your breast, and it's going to be a good experience because you're going to be aware of any change that your breast may have. And that's what you're going to need to know, what your normal breast feels like, and if there's any change from month to month, and then you contact your physician. BSE does save lives. Know your breast, call your physician, don't panic. Most things that we find in our breast are not cancer, but you need to be your own advocate. You're worth it. There are some organizations that promote BSE, the National Breast Care Foundation, the breastcancer.org, and ASCO, the American Society of Clinical Oncology, and National Consortium of Breast Centers. So there are some people that still advocate breast self-exam.
Thank you, Eleanor, for this very important information and sharing your expertise on this subject. Breast exams should start at age 20, targeting day 7 to 10 of your cycle. If you no longer have a cycle, you should pick the same day each month to do the exam. It is equally important for men to do this monthly screening as well, as it is a good time for them to be aware of changes in tissue so that they can also talk to their doctor about concerns they may have about breast cancer. As Eleanor mentioned in her presentation, it's so important for us to be advocates for our own health, whether that's through screening, talking to our doctor on a regular basis about concerns that we have, understanding our bodies, and knowing about changes in our health. As you can see from these numbers, the prevalence of breast cancer is high among women and men. Additionally, as this slide shows, the earlier the detection, the stronger the prognosis for survival. So it is very important for us to be talking about these early screenings so that people can have a greater chance of survival with early detection. For more information on cancer screenings, contact Kentucky CancerLink at kycancerlink.org. Again, our mission is to reduce barriers to screening, diagnosis, and treatment of cancer, and be a link to hope to those who are on a cancer journey. Thank you very much.